Conscious and unconscious athlete evaluation, primary and secondary survey. History. Try to get a history from those around. Mechanism of the accident or injury, previous medical history, current medications and or allergies. Observation. On the way to the athlete, while putting on gloves, determine environmental factors, weather, field hazards, equipment, and body position. An athlete laying on the ground with arms above head may indicate spinal cord injury. Severe bleeding, gross deformities, skin color. At the athlete, check for consciousness. If unconscious, send someone to activate EMS. Primary assessment. Do not remove the helmet. Check for obvious signs of life. Look, feel, and listen for breathing for 10 seconds. Get an AED. One rescuer, ratio of 30 compressions in 2 breaths, rate of 100 to 120 compressions per minute. 2 rescuers, rate of 30 compressions in 2 breaths. Switch when AED analyzes rhythm. Alert 911, CPR and rescue breaths in progress. Life-threatening bleeding. Check for severe bleeding. Control with direct pressure and pressure points. Brachial and femoral arteries. Spinal injury precautions. If assistant available, have assistant stabilize the neck and apply the C-collar. Log roll and spine board the patient if qualified assistance is available. Coordinate with the EMS. List signs/symptoms of shock. Pale skin color, cool clammy skin, weak and rapid pulse, shallow and rapid respirations. Pupils may be dilated when in shock. Blood pressure may be falling. Bright red indicates heat stroke, pale blue, hemorrhage. Taken vital. Check the level of consciousness, pulse, blood pressure, respirations, rate and depth, skin temperature and appearance, pupils, pearl. Secondary assessment. History. Where does it hurt? Do you have pain in your neck? What happened? Did you hear or feel anything? Do you feel any numbness or tingling sensations? Can you move your hands, wiggle your fingers? Can you move your feet, wiggle your toes? Orientation. Check level of consciousness. Ask who, when, where, what were you doing? Head to toe survey. Do quick check for obvious severe injuries, bleeding, fractures, deformities, edema. Look for normal to see abnormal. Scalp, eyes, ears, nose, and mouth. Blood, CSF. Cervical spine. Point tenderness, dislocations, abnormal alignment. Thoracic and lumbar spine. Point tenderness, dislocations, abnormal alignment. Trunk, clavicle, shoulders, chest. Movement on both sides equal. Normal rise and fall. Rib compressions test. Crepitus and false or abnormal movement. Abdomen. Check 4 quadrants and rigidity, tenderness, and rebound tenderness. RUQ. Liver, gallbladder, colon, right kidney. LUQ. Stomach, spleen, Kerstein, pancreas, colon, left kidney. RLQ. Colon, intestines, appendix, McBurney's point, ureter. Females, ovaries, fallopian tubes. LLQ. Colon, intestines, ureter, ovaries, fallopian tubes. R/LLQ, bladder, and uterus. Pelvis, compression test. Fractures, dislocation. Legs and feet. Check for fractures and bleeding. Check dorsal pedal or posterior tibial pulse bilaterally. Check motor response, plantar and dorsiflex feet bilaterally. If unconscious, scratch foot. Babinski's response. Great toe extension and other splayed equals upper motor neuron lesion. Check sensation. If unconscious, scratch each arch of the foot. Hands and arms. Check for fractures and bleeding. Check radial pulse bilaterally. Check motor response. Squeeze fingers bilaterally. Check sensation. If unconscious, scratch the palms of each hand. Recheck vital signs. Level of consciousness, pulse, blood pressure, skin temperature and appearance, and pupils, pearl. This concludes the primary and secondary assessment. I would maintain the airway and continue to perform breathing rescue breathing and or CPR until relieved by medical personnel. I would control bleeding, split fractures, treat for shock, recheck vitals every 5 minutes, and constantly maintain the level of consciousness. I would then refer my patient to a physician as needed.
Arms down.
Okay. Don't go too.
I won't do it as hard.
It tickles.
All right, you're just laying down normally.
Okay, fine. Oh God.
This is tickle.
Stop.
I already said tickle.
I need to restart.
No, that's okay.